Hello everyone, welcome to the Medic World Study with Dr. Mahi. We are with the next part of FMGE January 2025 recall. So let's start with the microbiology part. A carpenter with pneumonia presents with fever, cough, and lung consolidation. Colonies on culture shows green color and fluorescence positivity. Which organism is most likely? So the answer here is Pseudomonas aeruginosa. Next question. A 39-year-old patient with HIV and a CD4 count of 139 cells per microliter presents with altered sensorium and impaired consciousness. CSF examination using an India ink preparation reveals a positive result. Which organism is most likely responsible? The here answer is Cryptococcus neoformans. Next question. A patient tests positive on a microscopic agglutination test. What is the most likely diagnosis? The answer here is leptospirosis. Next question. For the diagnosis of typhus, an antigen of Proteus is used. What is this type of antigen called? The answer is heterophile antigen. Next question. A Zand smear shows giant multinucleated cells. Which of the following is the most likely causative organism? The answer here is HSV, that is herpes simplex virus. A patient's laboratory results were positive for malarial antigen, and Vidal test findings were as follows. O antigen more than 1 is to 20, H more than 1 is to 300, and A more than 1 is to 20, and B is more than 1 is to 20. What is the most likely diagnosis? It is reconvalescence phase. Next question is from community medicine. An image of the mascot is shown below. Identify the related national health program. First of all, identify the mascot, that is Sapna, and it is related to National Leprosy Eradication Program. Which is the nodal ministry for disaster management? The answer is Ministry of Home Affairs. A total of 60 patients were diagnosed with COVID-19, out of which 12 cases of deaths were reported. Calculate the case fatality rate. After calculation, the answer here is 20%. In a normal distribution, mean value is 82, standard deviation is 1.5. Calculate the range of two standard deviations. The answer here is 79 to 85. Which of the following is the population norm for an ASHA worker? Here the question was for an urban ASHA worker. So the answer here is 1000 to 2500. Which of the following vaccines is contraindicated in pregnancy? The answer here is varicella vaccine. Next question. Identify A and B in the given image. In the given image of larva A and B, the answer here is A is Anopheles and B is Culex. Which of the following is the duration of abstinence post-vasectomy? The answer is 3 months. Which of the following is the National Deworming Day? The answer is 10th February and 10th August. Now the next question. Identify the deficiency in the image shown below. In the image shown below, it is acrodermatitis enteropathica. So the answer here is zinc deficiency. Now the next question. In a study based in Delhi, doctors followed 100 people who did exercise for a year and later they checked who all had developed the coronary heart disease. Which type of study is this? This is the prospective cohort study. So, next question. Which of the following is the fractional IPV dose schedule under National Immunization Schedule? The answer here is 6 weeks, 14 weeks and 9 months. Next question. Which of the following is the management of HIV positive patient with multiple dog bites? The answer here is rabies vaccine plus immunoglobulin plus wound management. A person's father had colon cancer. He had bloody stool, so he just came for checkup. Before he had not undergone any screening, he was recommended to do colonoscopic screening. Screening is which level of prevention? The answer here is secondary level of prevention. Next question. Which of the following is the correct arrangement about the levels of healthcare? The answer here is subcenter and PHC are primary levels, CHC is secondary level, and medical colleges and hospitals are tertiary level. Which of the following health programs supports DANIDA? The answer here is blindness. Which of the following is not a food adulteration disease? The answer is fluorosis. Next question. Under IDSP, which diseases are included under sentinel surveillance? The answer is HIV and HBV. A 3 months old child came with complaints of fast breathing, of respiratory rate 53 per minute, with no chest intrusion. What is the diagnosis? The diagnosis here is pneumonia. A group conducted a mass gathering on hand wash awareness. Correct sequence of events. The answer is awareness, interest, evaluation, and adoption. Next question. Tourist guide is an example of third. Now, let's start the pharmacology section. Which antitubercular drug resistance is associated with the mutations in the CAT-G gene? The answer here is isoniazid. Which antiepileptic drug is commonly associated with gum hypertrophy and dizziness as side effects? The answer is phenytoin. Which drug is preferred for management of diabetes in a patient with cardiac and renal failure? The answer is SGLT2 inhibitors. Next question. Which adverse effect of bleomycin is exacerbated by radiation exposure? The answer is pulmonary toxicity. What is the key difference between cisplatin and carboplatin? The answer is cisplatin has more nephrotoxic side effects compared to carboplatin. Next question. A 25-year-old woman presents the emergency department 6 hours after ingesting a large quantity of paracetamol tablets. What is the most likely progression of paracetamol poisoning in this case? The answer here is increase in liver enzymes within 24 hours. Next question. In paracetamol poisoning, N-acetylcysteine is administered as an antidote. How does it act to prevent toxicity? The answer is restores glutathione reserves. Next question. Patient with rheumatoid arthritis is taking indomethacin and an ACE inhibitor for hypertension. What potential side effect is likely to be seen? The answer here is hyperkalemia. Which antihypertensive drug is contraindicated in pregnancy? That is enalapril, which is a ACE inhibitor. A patient with penicillin allergy presents with fever, burning micturition, and hearing problems accompanied by dizziness. Which drug is most appropriate for the management? The answer here is ciprofloxacin. A TB patient with HIV begins ART and experiences deterioration in health after 2 months. What is the likely cause? The answer here is immunological changes in the body, that is IRIS. A 35-year-old male experiences headache, nausea, and shortness of breath while trekking. The physician prescribes a drug to alleviate his symptoms. The drug administered primarily acts on which part of nephron? The drug which is administered here is the acetazolamide and it acts on the proximal convoluted tubules. So the answer is PCT. Which of the following drug doses is incorrect for the treatment of leprosy in adults? The answer is rifampicin 450 milligrams. Now let's start with the anatomy section. A 45-year-old woman presented with tingling sensation of the lateral three digits with loss of the sensation of base of thumb on the dorsal aspect of hand. Which is the nerve involved? The answer here is the radial nerve. Which of the following is the afferent limb of corneal reflex? The answer is trigeminal nerve. Which is the type of cartilage present in the histology section given below? The answer is A, that is highly cartilage. Identify the defect in the given image. Here, the defect given is of rachis ciscus. So the answer here is open neural tube defect. Identify the marked area in the image given. Here, the marked area is of pouch of Douglas. Identify the lymphatic structure from the histology section given below. So the answer here is thymus. Next question. Histological section is given below. Identify the marked cells. The hair cells which are marked are Purkinje cells. Now let's start with the radiology section. Which of the following methods is used to measure fetal anemia? The answer here is peak systolic velocity in fetal middle cerebral artery. A patient with a history of breast cancer underwent cobalt-60 radiotherapy. She now presents with respiratory distress and imaging shows haziness in the left lung. What is the most likely diagnosis? The answer here is radiation pneumonitis. A patient presents with a history of dysphagia, which is more pronounced for liquids than solids. Which radiological sign is most likely to be seen? Here it is a case of achalasia, and the sign which is seen is the rat tail sign. Which of the following is the primary use of this imaging modality? The imaging modality which is shown here is the endoscopic ultrasound, and it is used for the staging of esophageal cancer. What is the most likely diagnosis here? Here it is showing the bat-wing appearance, so it is the pulmonary edema. Now let's start with the orthopedics. A 20-year-old male patient presented with localized pain, which is gradual in onset and worsened over time. X-ray showed sun-ray appearance. Sun-ray appearance. What is the diagnosis? The diagnosis here is of osteosarcoma. Which nerve will be involved in the following finding on rest? Here the finding which is given is of ulnar claw hand. So the answer is A, that is ulnar nerve. Identify the instrument. Here the instrument given is the Bowler-Braun splint, that is PB splint. A 30-year-old meat accident and presented with the following finding. What is the diagnosis? Here the diagnosis is of anterior hip dislocation because the findings given is of Faber, that is flexion, abduction and external rotation of the limb. A 7-year-old boy was bound with bow legs and on X-ray of wrist. Following were the findings. What is the diagnosis? Here the diagnosis is rickets. Now the next question. A 42-year-old woman laborer presented with a visible soft and fluctuant swelling in front of the knee over the patella and some discomfort or difficulty with the knee movement. MRI findings are given below. What is the diagnosis? The diagnosis is of housemaid's knee. Now, physiology section. In the jugular venous pressure waveform, the A wave corresponds to, the answer is right atrial contraction. Which electrolyte abnormality will lead to cardiac arrhythmia in a patient with severe vomiting? The answer is hypokalemia. A patient presents with high BP accompanied by a decrease in heart rate. What is the most likely physiological mechanism responsible for this response? The answer is stimulation of chemoreceptors. Next question. Which of the following describes the chloride ion exchange in red blood cells where bicarbonate ions are exchanged for chloride ions to maintain electrical neutrality. The answer here is hamburger effect or chloride shift. Only one option was there in the exam. Which of the following factors causes the rightward shift in the oxygen hemoglobin dissociation curve? The answer is acidosis. A 50-year-old patient presents with respiratory difficulty and a history of chronic smoking for last 30 years. Pulmonary function testing shows a decrease in FEV1 percentage. What is the most probable diagnosis? The answer here is COPD, that is chronic obstructive pulmonary disease. Which of the following changes occurs during muscle contraction while exercising? The answer here is eye length decreased. What is the mechanism of action of botulinum toxin? The answer is inhibits acetylcholine release from presynaptic terminal. A renal biopsy image is shown. Identify the cells marked in the histological section. The answer here is extraglomerular mesangial cells. Dehydration is more severe in infants as compared to adults. Which of the following is true statement about infants? Extracellular fluid is more than intracellular fluid. The answer is a hypertensive patient's lab results reveal hypernatremia, hypokalemia, and metabolic alkalosis. What is the most probable diagnosis? The answer here is Conn's syndrome. During spermatogenesis, which of the following hormones inhibits FSH secretion? The answer here is inhibin. Next, start with the FMT section. After 3 years of marriage, a woman died. Her father filed a report to the police and inquiry will be done under the 196 section of BNSS or 176 CRPC. Next question. Death of a female within 3 years of her marriage. Death in police custody is reported. Inquest will be conducted under magistrate. Next question. Death in police custody is reported. Inquest will be conducted under judicial magistrate. Next question. A forensic expert received summons from district court to record his evidence in a criminal case, but 2 days back he has already received a summons for civil case in district court for the same day. What should the doctor do? Attend the court for the criminal case. Next question. Leading questions can be asked in cross-examination. A villager was assaulted by 4 to 5 people and brought to the hospital in a serious condition. His dying declaration was being taken in the hospital. What is correct regarding this process? Can be recorded without oath, oath not to be taken. Next question. A person got stabbed on his anterior thigh and died. His body was brought for post-mortem. What type of injury is this? This is a type of penetrating wound. A person fell down and got injured presents to you with brownish scab formation on it. What is the estimated time of injury? The answer here is 4 to 5 days. The body came for autopsy was cold and have developed rigor mortis in all 4 limbs and livor mortis at back and back fixed, but no signs of putrefaction. What will be the estimated time since death? The answer here is 6 to 12 hours. Next question. Patient came to the hospital with muscle weakness, diarrhea, bradycardia. He was diagnosed with organophosphate poisoning for which atropine was administered. After atropine administration, which of the following changes are not seen? The answer here is muscle weakness. Two friends were working together at the construction site. A hammer fell from one friend's hand onto the another friend's head. The X-ray revealed the fracture. This is what type of fracture? The answer here is depressed fracture. Next question. During forensic examination, a skull bone was found by the police whose cephalic index came out to be 85. Skull bone belongs to which race? The answer here is Mongoloids. Phosphine gas hypoxia is which type of hypoxia? The answer is histotoxic. Corneal transplantation time is 6 hours within death. A chronic alcoholic for last 7 years and could not drink for last 2 days, disoriented, delirium, and sensation of spider running on the skin. The condition is delirium tremens. Next, obscine. Radiological image was there showing the string of pearl sign. The answer was PCOS. Bluish discoloration of the cervix and vagina was given. What sign is this? This is the Chadwick sign. A 27-year-old woman presented with irregular periods, acne, and excessive hair growth. What is the first line of management? The answer was lifestyle modification. Which of the following is involved in milk ejection reflex? The answer is oxytocin. Home-based pregnancy test is based on beta-HCG. Earliest sign in pregnancy on TVS is gestational sac. Which CVS changes are not seen in pregnancy? That is diastolic murmur. Identify the CTG pattern. That is early deceleration. The CTG pattern was given of early deceleration. Image of Wrigley's forceps was given and the ask was this forceps is not used in obstructed labor. Baby head is delivered but shoulders not delivered. After how much time will we call it shoulder dystocia? The answer is 60 seconds. Identify the procedure. The image was given of intrauterine balloon tamponade. A woman had difficult labor and C-section. She complained of dribbling of urine on seventh day of delivery. The answer is vesico-vaginal fistula. Which hysterectomy has less chance of ureteric damage? The answer is vaginal hysterectomy. OCP does not prevent which cancer? It is breast cancer. Drug of choice for endometrial hyperplasia is LNG-IUS. In cervical cancer, which radiotherapy is given? That is platinum-based radiotherapy is given. Now let's start with the DMAT section. Rapid and significant hair loss in a woman undergoing chemotherapy most likely cause is anagen effluvium. Image of a patient with psoriasis. What sign is seen here? It is the Auspit sign. Patient with painful genital ulcer and bilateral lymphadenopathy. The diagnosis is chancroid. Treatment of acne vulgaris is isotretinoin. Now, the biochemistry section. IgM anti-HBC is associated with acute infection. Treatment for bite dot spot is vitamin A. Gum bleeding is seen in vitamin C deficiency. Deficient enzyme in a small child with ochronosis is homogentisate oxidase. A 4-day-old child with 15 milligram per dl bilirubin. The diagnosis is physiological jaundice. Diabetes mellitus cataract is due to what deposition? The answer is sorbitol. Pneumoconiosis particle size is 0.5 to 3 microns. Phosphatidylserine flipping is seen in apoptosis. Least likely hemolytic anemia causing pigmented gallstones is HBD Punjab. Newborn with heart defect, hearing loss, and cataract. Diagnosis here is congenital rubella syndrome. Gene related to hand-foot-mouth disease is the FOX gene. Carbohydrate deficiency leading to essential pentoseuria. The answer is L-xylulose. Enzyme removing triglycerides from chylomicron is the lipoprotein lipase. Control of enzyme activity by phosphorylation or dephosphorylation is covalent modification. Cause of hypoglycemia in chronic alcoholics is inhibit the gluconeogenesis. Next question. Enzyme deficiency in Natowitz syndrome is hyaluronidase. Enzyme affecting collagen maturation in vitamin C deficiency is lysyl hydroxylase. Now, the psychiatry part. A 24-year-old male previously diagnosed with a psychiatric disorder has become aggressive with his neighbors, is speaking rapidly, and is sleeping very little. He also exhibits hyperactive behavior after discontinuing his prescribed medications. What is the most likely diagnosis? The diagnosis here is the bipolar disorder, that is a manic episode. A doctor asks a patient about her age. The patient responds, "You know, doctor, I am from a village. We were married at a very young age, at 12, with my husband, who is just 5 years older than me. Then I had two kids when I was around 18 or something. Now I look like an older sister, like their older sister. I'm just 32, doctor." What is the most likely thought disorder displayed by the patient here? This is the answer is circumstantiality. Next question. What kind of symptoms does the term affective flattening imply? The answer here is negative symptoms. A lady presents to the hospital after having fight with her husband. She reports that she is unable to speak. However, all the neurological and physical examinations are normal, and she doesn't seem concerned about her health status. What is the most likely diagnosis? The diagnosis is labile indifference. Next question. A 28-year-old woman diagnosed with schizophrenia had been compliant with her prescribed olanzapine for several months. However, she discontinued the treatment. Which of the following is the most likely reason for her discontinuation? The answer here is the weight gain. Now, opthal part. D-shaped pupil is seen in iridodialysis. Cover-uncover test is used for latent squint or phoria. Significant difference in refractive error between both the eyes is anisometropia. The image was given of Marcus Gunn jaw winking syndrome. Homonymous hemianopia with macular sparing is seen in defect in occipital cortex. The image was given of cystoid macular edema in Irving gas syndrome. Magnification of indirect ophthalmoscope is 3 to 5 times. Substance deposited in heterochromia iridis after eye injury is the iron. Best treatment for soft block at 7 mm in 2-year-old is conjunctival DCR. Diagnosis for eyelid crusting and gritty sensation is chronic blepharitis. Diagnosis for proptosis increasing on bending is orbital varices. Now let's continue with the medicine part. Graham's steel murmur is seen in pulmonary regurgitation. Water hammer pulse is seen in aortic regurgitation. Unstable patient with BP less than 90/60, irregular pulse, and absent P wave. Management is cardioversion. First degree AV block is seen in prolonged PR. Drug of choice for malignant hyperthermia is dantrolene. In osteoporosis patient on joint therapy, we ask the patient to maintain an upright posture. This is due to reduce the risk of esophagitis. Diabetes patient on metformin with HbA1c more than 7.5. Next step in management is increase the dose. Iodine 131 side effect is hypothyroidism. Noradrenaline effect is increase the BP and decrease the heart rate. Patient on warfarin therapy recommended INR is 2 to 3. Patient with asthma has had symptoms consistent with PSVT. Drug preferred is verapamil. Latanoprost side effect is pigmentation of iris. Cyanosis after 48 hours of bone fracture. The diagnosis here is fat embolism. A patient presented with family history of type 2 diabetes mellitus. Screening should start from 30 years of age. Last link in ACLS chain of survival is recovery. Neck vein dilated, cord-like structure is palpated. The answer is external jugular vein. Which drug is stopped before anesthesia is the ACE inhibitor. To control the hypoglycemia, which drug is given? Glucose oral or IV, or glucagon IM or intranasal. Nitroglycerin route of administration in ICU patient is IV. Finding not associated with Panco's tumor is exophthalmos. Now, the PEDS part. Use of Shakir tape is an example of appropriate technology. A child with increased upper segment is to lower segment ratio. The diagnosis is achondroplasia. Which parameter is affected in chronic malnutrition? The answer is height for age. Thank you so much.